Hello, everyone, and today we are going to talk not just about blood pressure, but about the fear related to high blood pressure. Because many people are not living only with hypertension, they are living with fear. And can be fear of stroke, this can be fear of a heart attack, it can be fear of the numbers on the monitor, it can be the fear of a sudden spike. And sometimes these fears, they actually are bigger than the real medical risk. So in these 30 minutes, we will do three things. First, I will explain the 10 most common fears that people have about blood pressure. Second, I will explain how doctors measure this real risk. And third, I will show you how coaching can help calm these fears and regain control. So why fear matters? Let's start with something very important. The fear changes the body. So when we feel afraid, the body activates what doctors call the sympathetic nervous system. That simply means that we activate that part of the nervous system that prepares the body for action. Heart rate increases, blood vessels tighten, breathing becomes faster, and of course, blood pressure rises. This response is actually useful if you are escaping danger, but it can also happen when you simply look at your blood pressure monitor. This means that sometimes the numbers on the screen of the blood pressure monitor is not just your blood pressure. It is your blood pressure plus the fear of the number. And understanding this helps us interpret our blood pressure readings in a much more realistic way. Let's go straight to the most, popular, if I may use this word, at least the most widespread fear. And this is the fear of stroke. So, when I asked in our Facebook group, Blood Pressure Help, what is it that you are afraid most with regards to your blood pressure? I think that 90% of the answers were it is a fear of stroke. And this is, of course, the biggest fear that people have about their blood pressure. Because many people believe that there is something they call a stroke zone. They think that once your blood pressure goes above 180, a stroke is almost guaranteed. This belief is extremely common, and I was hoping to, in the poll, to find out how many people who are present online actually share this belief. But okay, sorry, we'll do it without polls this time. Um, there is one very important thing to stress about it, and this is that this belief is common, yes, but medically it is totally not correct. Doctors call blood pressure 180 over 120 for a hypertensive crisis. Yes, this means that blood pressure is very high and it needs medical attention. But it does not, and I emphasize, it does not automatically mean that a stroke is happening at that moment. Now, let me explain what a stroke actually is. Stroke happens when the blood flow when blood flow to a part of the brain suddenly stops, and the brain needs oxygen constantly. So when blood flow stops, brain cells start dying. And there are two main types of stroke. The first is called ischemic stroke, and this is the most common type of stroke. This ischemic means lack of blood flow. So this type happens when a blood clot blocks an artery in the brain. And the second type of stroke is called hemorrhagic stroke. Hemorrhagic means bleeding. This happens when a blood vessel bursts inside the brain. High blood pressure increases the risk of both types, but usually the damage develops slowly over many years, not from one single reading. Doctors estimate stroke risk by looking at the condition of the arteries. For example, they may do an ultrasound of carotid arteries. These are the large arteries in the neck that simply that that supply blood to the brain. They may also look at cholesterol, diabetes, smoking history, and other factors. Now, let me explain how coaching can help here. In the coaching sessions, the first step is clarifying this fear. And in fact, in coaching sessions, it is the first step to clarify any fear. I often ask a client one simple question. What exactly do you believe this number means right now to you? And many people answer to me something like this. This means that I have a stroke tonight. And then I'm trying to convey a very important message that I really want you to understand. A blood pressure number is information. It is not prophecy. It is information. It is not prophecy. So from this setting, we, together with the client, try to start developing the separation of the fear from the number. And this helps many people think clearly again. Now, the second most often mentioned is the fear of a heart attack. A heart attack happens when blood flow to part of the heart muscle stops. So when it's a stroke, it's about the brain. When it's a heart attack, it's about the muscle. And usually this happens because a blood clot, again, blocks the coronary artery. Coronary arteries are the arteries that supply blood to the heart. Often, the clot forms on top of something called plaque. And the plaque is a deposit of cholesterol and inflammatory cells inside the artery wall. Over many years, plaque can narrow arteries. If it ruptures, a clot can form and block blood flow. High blood pressure accelerates this process. But again, this is usually a long-term process, not something caused by one temporary spike. Doctors estimate heart attack risk by looking at quite a few factors. Blood pressure, of course, cholesterol, blood sugar, smoking history, family history. Sometimes doctors use a test called the coronary calcium scan. This scan detects calcium deposits in the heart arteries. Calcium usually means plaque is present. Now, what can we do with coaching here? When people fear heart attack, they often think that danger is immediate. And that's why, sorry, I will just put there, I look into my notes. Yeah. So, in coaching, I try to introduce the following setting that yes, the risk is real, but the risk is not the same thing as immediate danger. And then we try to create what is called a prevention map: sleep, exercise, nutrition, stress management, medication. When there is a clear plan, fear decreases dramatically. Now, then there is another type of fear, that is the fear of the single reading. And it is basically fear of the number itself, because some people are not thinking about the stroke or heart attack. They're simply afraid of the number. For example, 160, it feels scary, right? And then, but then, 170, it can feel dangerous. And the 180 feels catastrophic. But blood pressure reading is only a snapshot in time. Doctors care much more about patterns over time. That is why many doctors recommend measuring blood pressure at home over several days, the 3 days measurement, or using a 24-hour home monitoring, where a small device measures blood pressure automatically once an hour during 24-hour periods of day and night. This helps doctors see real pattern. Now, what the coaching approach can help here with? Often I start with saying one number is a moment, a pattern is data. When people start looking at patterns instead of single numbers, anxiety drops quickly. Now, Then there are all kinds of measurement anxieties. And I have united it with white coat hypertension because basically it is about the same thing. It is that some people feel anxious even before the number appears. The cuff inflates, the arm tightens, the device beeps, and the body reacts, of course. The heart rate raises, the muscle tighten, blood pressure increases. This phenomenon, when it happens at doctors, it is often called white coat hypertension. This means that blood pressure is high in the clinic, but normal at home. Doctors often confirm this by comparing clinic readings with home readings. So how coaching can help here? I often teach clients a simple measurement routine. Sit quietly, feet on the floor, relax the shoulders, slow breathing for 1 minute, then measure again. The white coat hypertension, white coat syndrome, is not really something that we can, in fact, control because this happens to us. It actually happens in our subconscious. So we really, what we can do with the coaching is that we can mitigate it. And in fact, I had recently, I was coaching a client who had a white coat syndrome, very pronounced. And what helped her was coming to her doctor's office, to the reception, and just sitting there for, sort of 5, 10 minutes, and then leaving. So this actually helps quite a few people. The next thing is the fear of sudden spikes. Now, this is also a very common situation because many people think that this means when they see a sudden spike, when their blood pressure has been normal, and then spikes and then goes back to normal again, for example. They see this as something terrible is about to happen. But the thing is that blood pressure fluctuates normally during the day. It changes with stress, it changes with movement, with exercises, it changes with temperature, and it changes, of course, with pain, and it actually changes with conversations. So doctors often use the 24-hour monitoring to understand whether spikes are occasional or constant. Now, how the coaching can help here? Instead of panic, we use curiosity. So I ask a client this question: What happened in the 2 hours before this reading? And very often we try to find, and we find clear triggers. It could have been poor sleep. It could have been a stressful meeting, or a cup of coffee, or simply checking too often. Understanding these patterns definitely reduces fear. Now, about the hypertension. I'm sorry I made this slide. I hope it's not too scary, but basically I wanted to illustrate that hypertension is often called the silent killer. This phrase already creates fear. People imagine damage happening constantly without warning. Why hypertension is called silent killer? Because it is typically asymptomatic. So it doesn't have symptoms in most cases, but it is present and it presents danger. So doctors do not leave the silent killer invisible. They check for organ health, kidney blood tests, eye examinations, heart ultrasound. These tests allow doctors to detect damage early. And when I work with people who are afraid of the silent killer, and this also is a situation that I meet a lot. I usually start with saying that unknown does not mean uncontrolled. Unknown means that we need to measure, because fear decreases when uncertainty becomes measurable. Now, let's go to also another very widespread fear, and this is the fear about medications. It is there are all kinds of medication-related anxieties, but one of the most common uh, are side effects: dizziness, fatigue, ankle swelling, sexual side effects. These concerns are very understandable, but medication plans can usually be adjusted. And doctors monitor kidney function and electrolytes so they can change dosages when needed. Um, for coaching, what is important is that such fears very often happen before people take medications. They're afraid of the fear of something that did not happen yet. So instead of arguing with fear, I say, let us separate side effects you experienced from side effects you are expecting. And this kind of small distinction, it may sound small right now, but we actually start working from there. And then there is another very common fear, and it is a fear of exercise. Here, I want to tell you a little episode. You know, when I was when I was developing Heartery, this app to help people support blood pressure, I have interviewed several hundred people with high blood pressure, and a part of our conversation was about what are they afraid of. And I remember one woman told me that she compared her heart with an engine in the car, and she said, like, when the car is faulty, you don't take it out of the garage uh, and start driving around. So better I sit on the couch and not go to any gym because God knows, what if I fell and die on the treadmill? Uh, this fear has to be treated with respect, just as any other fear. But also, the thing is that when you exercise, especially when you do an intense exercise, to keep your heart rate elevated, it actually raises blood pressure. It falls afterwards, and that's what our aim is. But why it happens? It's because when muscles work, the heart pumps harder to supply oxygen, and over time, regular exercise usually lowers resting blood pressure. Doctors sometimes use stress tests to assess blood pressure safety of this or that exercise. Uh, when I worked with fears related to exercises, I usually start with saying that we are not training bravery here. What we do by exercises is that we're building evidence. We start small, short walks, gradual increase, your confidence also grows. So that's how to work with this fear. Now, then there is a fear of salt. Let's put it this way, because again, it is a very objective fear, and it has to be treated with respect. Many people believe that one salty meal immediately causes dangerous blood pressure, and salt does influence blood pressure. There is no question about it. But the most important factor is the overall dietary pattern, not a single meal. Some people are more sensitive to salt than others. Doctors sometimes estimate sodium intake using urine testing. Uh, Coaching focuses on a gradual change. Less processed foods, more potassium-rich foods like vegetables and beans. Uh, Small steps, they work better than strict rules. Another poll was supposed to be here. Sorry about it. But now we come to, fear number 10, which is basically the fear of the diagnosis. And um, it is sometimes because what happens when your doctor, maybe you can recall the situation when your doctor told you that, oh, you know what, you have high blood pressure, you have hypertension. It happened to me some 20 years ago, and I remember I was thinking to myself, okay, so now I am a heart patient. Um, the reality is that hypertension is extremely common. Some 10 to 15%, in fact, most researchers believe it's even higher number. 10 to 15% world's population have high blood pressure. It does not make it normal, of course, but the reality is that in contrast to many other serious diseases, hypertension can be managed successfully for decades. So you can live a full and high quality life with hypertension. And that's why it is important when I work with people who are, and also it is very often that I work with people who experience what is called the identity loss. The message that I'm trying to convey to them is that you have a condition to manage. You do not need to build an identity around it. So this shift alone can change also how people live with hypertension. In this situation, people come to me often when they cannot express what scares them. They just feel scared the moment when they wake up. And what happens in coaching is that we try to basically localize this fear first. We try to set the boundaries. We try to, sometimes give a name to this fear. And then we try to find a place in the person's life, everyday life, for this fear, so that it does not take over, so that it can be controlled. Now, we have arrived to the conclusions of my talk, and there are basically three messages that I want to leave with you. That blood pressure fears are very powerful, and that they have to be treated with respect. That you cannot just say, "Oh, don't worry." It actually only causes aggression from the person to whom you are saying it to, and this you have to understand it. The thing is that very often fear exaggerates the real danger. The medicine provides tools to measure risk accurately, and coaching helps people regain control over their thinking and over their habits. When you understand the difference between the numbers, the patterns, and real risk, blood pressure becomes something you can manage, not something that controls your life. So this is what I wanted to tell you, and thank you for listening. And now I will switch. I will stop sharing my screen, and I will be open for your questions. You can write them in the chat. There is a button right under the screen. And also, let me see. Right. Also, what I can do, to be frank, I did not try it before, but I will. There is something called allow to talk. So basically, I will allow everybody to talk, and if you have your microphone on, you can ask your question also with voice, or again, you can write it in the chat. if you have any questions, because maybe I have explained everything so clearly that there are no questions. Please, I hear somebody switched on their microphone. Let me see what is.
Hello.
Yes, hello.
Hi, it's Michelle.
Hello, Michelle. Hi, how are you?
I'm good. I'm still struggling with I can put the cuff on, I can sit there, I push that button, and all of a sudden my heart just starts going again. So I
Uh,
don't feel like I'm getting a good reading.
I know a bit about your situation,
Yeah.
Michelle. We have met before. Uh, I think that it's about control, basically.
Mhm.
It's about who controls what. Is it you who control it? And control comes from the realization of that what you're going to get right now is just a snapshot. But yeah, I understand you very well. It's also something that I meet very often in the coaching sessions with other people. It takes time and it takes effort to regain control, but it is totally possible.
I mean, I'm actually like thinking, should I ask my doctor to up my medication to help with this? I don't know if that will fix it or not.
Um, I cannot answer without knowing what medications there are, and also, I would rather not go into the medical questions. As you know, I can only support what your doctor tells you to do, and
Yeah.
this is my approach. But I th there are the regular blood pressure medications do not cause any sort of psychic responses. So, in fact, most blood pressure medications, if they do anything with your stress, they relax you. Not that there is their direct effect, but it happens.
My
Uh,
I'm only on like 5 milligrams of amlodipine,
mhm.
and I'm wondering if I should ask them if I should up it. I
Uh,
mean, my numbers are good, but as we've talked, it's, when I take a little quarter of a Xanax and my body comes
yeah,
down. So I'm unsure if I'm getting a true reading or not.
your reading is definitely affected by Xanax.
Yes.
So the aim should be to get rid of the Xanax, not to get rid of not to. I mean, if your readings are good, it means that amlodipine definitely works. So it's the Xanax situation that you have to address. That's for
Oh,
sure.
yeah.
And
It's
maybe
not like
that's
I
a
take it.
question to the doctor.
Yeah, I don't take it every day. I just know when I don't take it, I think I'm getting very elevated readings because I can't sit down and take it without my heart pounding out my chest.
About a doctor, I think it will help your doctor to make an informed decision if you bring him two sheets of paper. On one, blood pressure measurements without Xanax, on the other, blood pressure measurements with Xanax. And if there
Yeah.
is a pattern, and especially if there is a fixed difference between the two, or sort of more or less same difference between the two, then I think there is a very good reason to discuss what to do
Yeah.
about it medically. But I think that it's also possible to help you, by means of coaching to get more
Yeah.
control.
I think the my biggest concern is I don't think my blood pressure skyrocketed, but I don't think it's where it should be or where it could be if I could get that anxiety under control.
That's true. That's true. It can be, I mean, it can be a very powerful thing that actually distorts. That's the distorts the reading, and that's a real problem.
Yeah.
Let me, Michelle, let me answer the two other questions that I
Yeah.
got. It's I'm sorry if I pronounce your names wrong. I'm terrible about it. So, but Findale asked about can blood pressure be reversed? Well, high blood pressure be reversed? It's a question that I get very often, and no, there are. I think it's actually it's not as simple as people say. Some people say yes, some people say no. There is a very, but what the guidelines mean is that there is a very clear distinction between two things: persistently high blood pressure. That is when your numbers are over 140, over 90, either number, and when they are stable there, which means that you have hypertension, which means that you have high blood pressure. If you were diagnosed by your doctor, by, well, medical doctor, with high blood pressure, then the bad news is that, sorry, no, in absolutely most, I'm trying to refrain from the word always, but in the absolute, like over 90% cases, no, it cannot be reversed. This is the bad news. But the good news is that it can be managed. So it can be with medications and proper lifestyle, it is perfectly possible to lower your high blood pressure into the normal range and keep it under control there for many decades, for as long as God left you to live. And now but there is another very important part that people often forget. That is when your blood pressure is not high but elevated, when it is in this magic zone between the normal range and hypertension. And that is when it's over from 120 to 139 in this range for systolic, and from 80 to 89 diastolic. So if your blood pressure has never been higher than that, or like occasionally higher, but mostly stays there, and it's not a result that it had been very high and then you managed to calm it down and put it there, but when it simply has never been it's never been in the hypertension range, when it's elevated, then yes, it can be reversed. In quite a few cases, it can be reversed mostly by adherence to the heart healthy lifestyle. And I've seen many cases when it has been successfully reversed from elevated range, not from the high range. Now, the guidelines, there is also a question by K Ben, about that the guidelines have changed since the 70s. Why? Yes, so what happened is that uh, about 100 years ago, hypertension was not treated because it could not be measured, basically. And or well, now it's a little bit over 100 years ago. But then we have invented the blood pressure cuffs and so on. And from the start of the last century until 1970s, there was no grading. So there was only a hypertension or no hypertension. And the border was, in fact, as it's still till today, is 140 over 90. So everything over 140 over 90 was considered hypertension. Everything under was considered no hypertension, did not require treatment. In the 70s, the mortality from heart rate and strokes was much higher than today. And this is because, well, partly, I mean, why it went down so much. I mean, in some countries it is tenfold. And this is because, first of all, we became more
Right.
aware of the heart healthy lifestyles, but also because new medications have been developed, and this has allowed grading. So grading was introduced in the 70s, or well, it was introduced in the 80s, and so when it was not just hypertension or no hypertension, but the charts were introduced. So we have in the United States, it is low, normal, stage one, stage two, and then sometimes called stage three or crisis. In the rest of the world, it's that follows the European Society of Cardiology chart. It's sort of pretty much the same, just that the stages are called grades, and they a little bit differ in numbers, but in general, it is it's sort of it's the same. And now, yeah. So that's how we, in fact, became. That's how the changes were introduced, and that's how they are helping to have more blood pressure control. Right. Yeah, then we have one more question also by Findil, sorry, or Findile. I apologize for if I mispronounce your name. Why blood pressure medications causes dizziness? No, of course, not all blood pressure medications cause dizziness, but some do. And it is important to, I think that it's important to understand something about side effects. Because when people ask me why this medication causes dizziness, for example, the reality is that it does not cause dizziness in most people. If it caused dizziness in most people, they would not allow it on the market. The most common side effects, and we have a classification by incidence of side effects from common to rare. And the most common side effects, they affect no more than 10%. I think that the most common amlodipine ankle swelling and feet swelling amlodipine is about 15%, affects about 15% people. So it does not cause dizziness, but it may cause dizziness. And why this is an area that it can be for all sorts of various reasons. But the thing is that if it says, if you read the list of potential side effects, many people, get really worried because they think that it actually means that all these terrible things will happen to them. But it's important to understand that the keyword here is potential. So it may happen, but it is much more likely that it will not happen. How to know it on beforehand? There is no way to know it beforehand. The only real, I mean, there was a lot of research about it, and still, of course, is ongoing. The reality is that the only sort of very vague dependency that is not even it doesn't happen to all is that the more fit you are physically, the less the likelihood of side effects. But again, it does not mean that people who are not fit, who are fragile due to age, that there will be more like much higher likelihood of side effects. in individual cases. In general, yes, but so it's kind of, yeah, that's where we are with regards to this question. All right. Any other questions that you can pose? You can pose them by voice or. All right. Another question from Findal. My blood pressure is never 140, but I'm taking three medications and amlodipine make me disoriented. M42 years, I think it's maybe it says male, 42 years old. Yeah. Um, yeah, it's I will never say stop amlodipine, of course, because amlodipine is one of the most effective blood pressure lowering medications. And because I'm not here to provide medical advice, I cannot do it legally, first of all. What I would like to say, though, that if it happens to you for longer than 2 weeks, uh, you can definitely get back to your doctor and discuss what is possible to do. Now, the problem is that in some cases, the doctor will tell you that it's not possible to do anything or else than what is doing now, that your body will adjust, which is the case in which, yes, it happens. But at least in most cases, uh, there are always, we're actually quite lucky that we have such a diverse uh, range of various blood pressure medications. And even amlodipine, even though it's one of the most widespread blood pressure medications, it is definitely not unique in its drug class. And it's always possible to find another medication in the same drug class that will have the same effect. But in general, it usually takes 3, 4 attempts to find the regimen that works for you. That means, sorry, that it lowers your blood pressure and that that it has no significant side effects. Right, there is. Can I take amlodipine at night? That's a question to your doctor. That's I cannot answer this question. In general, yes, doctors prescribe amlodipine to be taken in the evening or in any other part of the day because it has to be a part of the regimen. That I mean, you are taking three medications. One of them is amlodipine. So it looks like it looks like you are in good hands there. So, but you have to ask your medical doctor about it. All right. It seems like there are no more questions, and so it's all right. Well, I want to if I want to thank you first of all for joining online. I will see if I have recorded this webinar successfully, and I will edit the recording a little bit to cut the end and the start, and will upload it most likely to YouTube. And I will share the link in Blood Pressure Health group. And we are planning other. We're actually planning other webinars. It's with one of the participants to this webinar. She was here, Suleima. She's a specialist in breathing techniques with focus on breathing that lowers blood pressure. And we are planning a webinar with her. And also in our group, Blood Pressure Health, I will be asking you what time, when to hold these webinars, because I'm usually trying to do them on a weekend, on Saturday or on Sunday, so that to get the attention of people who may be working on the weekdays. But also quite a few people told me that, for example, on Sunday they cannot attend because they are going to church or they have other things to do on Sunday. So I will be asking you guys in the group about it. For now, I want to thank you to everybody who joined, and goodbye, and see you in the group.